Well, hey, Renee, coming to you from a remote location today.
I can see that. You got quite the background behind you. It looks kind of like a really tall building and some outside. You got good weather. So tell everybody, Jason, where the heck are you today?
We're in Texas. We
Ooh.
are howdy, is what we are down here in Texas, Renee.
All right. Well, today, everybody, we're going to be talking about he's live at Torch, which is the Texas Organization of Rural and Community Hospital Conference, which sounds fun. And it sounds like they've already gotten themselves into some trouble while doing this. So there's a lot of stories ahead. So you're not going to want to miss this. But your trip started with a visit with Governor Abbott. Please tell me what that's about. You had a governor's, and you've posted already on social. For those of you that follow, you might be able to see
Yeah.
this. Talk about what happened with Governor Abbott. What all are they talking about there?
Yeah, well, it was great. The conference was kicked off by Governor Abbott, who signed two pieces of legislation that they just
Cool.
passed in their second special session. They've been going through a lot of special sessions down here in Texas
Mm.
this summer, and they're really focused on how they're going to use the funds in the big beautiful bill B3. We talked about that in earlier podcasts of how they're going to leverage their funds and get those
Mm.
back to rural communities all across the state. And so he signed in front of us HB. Oh, I just lost my notes, Renee.
18. 18.
HB 18 and HB 3000. And we had a number of legislators here. And so, it was really good to see that energy that this governor has been very committed to supporting healthcare through his tenure. He was one of the most popular governors. He
Mhm.
was the most popular governor in the country in 2020. He has a long history here, and people in Texas really like him.
Yeah. So it sounds like you had, I mean, I got to see the photo and it was just tons of people, which is really cool. It's always neat when they do a big public event, especially for health. And so
Yeah.
it's cool that it's going to impact the people that are at this conference. So it's like $5 billion that I think is like infrastructure dollars. We're going to have it here in the show notes so people can look at it. But HB 18, what's all in it? What's it going to help Texas do? Is it for infrastructure and like building up buildings and
Yeah.
new programs? Is that what we're working on?
It is. I mean, and so, Secretary Kennedy was down here. And so, Governor Abbott's been working very diligently to leverage those funds that are coming in to build back the infrastructure, to kind of look at some of the workforce stuff. They're really getting ahead of that. And as this show airs, we should know what the requirements are to get those other dollars that are going to go
Mhm,
to the
mhm.
states, right? There's two parts to it. Every state gets an equal part, equal share. And then states have to apply for the other funding that gets drizzled out over the 5 years. And Texas is looking to scoop some other states because there's a
Oh,
couple
wow.
states that don't have critical access hospitals. So I think we look at Rhode
Oh,
Island. So they're not going to get that other half. And so it's going to be a lot of discretion within the federal government of how those dollars go out. But I think Texas has a plan of what they're going to do across all of their counties. And remember, Texas has 254 counties, Renee, and
yeah.
191 of those counties are rural. So when we think about rural infrastructure and having access to healthcare in rural areas, it's really important here.
Yeah. Brent and I used to live down in the Dallas Fort Worth area, and we were never in the rural part of Texas. But when we lived out in New Mexico and you get down to El Paso, then everything is rural from there on. So we've driven through a ton of rural Texas, and you're right. It's big, vast, and airy. And so there's not a lot going on in those communities. So this $5 billion will go a long way. Well, one of the other things that you mentioned is that while this is going on and it's all positive, it sounds like there's some other news about Texas coming out that maybe not so positive as we move into the data section. So $5 billion for infrastructure seems like a really big deal, but what's the other side of this big, beautiful bill?
Well, I was kind of asking some folks here that I'm not. I kind of led it with I'm not good at math. But I've been reading stories, and KFF had an article. It came up my LinkedIn feed, ironically, yesterday as I'm sitting here listening to all of and giving standing ovations to Governor Abbott for all of this work. And I'm reading in an article that, according to the Congressional Budget Office and KFF has done an analysis, that the Texas stands to lose $39 billion over the next 10 years in lost Medicaid. Now,
That's a
the
lot.
providers and the hospitals and the rural health clinics I'm sitting with, 60% of the folks that go there have Medicaid. And so I don't understand how care is going to be paid
Mm-mm.
for the next 10 years because they're going to be losing $4 billion a year here. So
Yep.
this little short-term investment that could only go to infrastructure doesn't make up for that $39 billion that's projected to be lost. And so how does the system sustain itself when we know these numbers aren't adding up? And I thought it
Right.
was just me. So I'm asking around, like, do I not understand this or am I
You
missing
understand it.
something?
No, you understand it. I looked at that same article too, and they're losing like 550 million just from public health and pandemic funds. And so that by itself, when you've got a border that is permeable and people continue to come in with all
Um,
kinds of issues and diseases, if we have no public health, no vaccinations, no nothing to help with that. I mean, and we've already got different outbreaks across our country of
yep.
measles and other things. And so it's bigger than just behavioral health, which is all lumped in here too.
Some
But we've got
and
some
remember,
big
those were
losses.
here. Those measles outbreaks were here. I was
Oh,
with a
geez.
health clinic that they're a standalone rural health clinic and didn't have support from their local hospital and weren't sure on what they should be doing. And they had
Wow.
trouble getting guidance. So, I mean, I think it shows our infrastructure, our healthcare infrastructure is very fragile. And so I do worry about states like Texas of what does this mean for folks in rural areas who count on that. We're going to see a decreased ability of the safety net to be able to manage care. There's just no question about it.
Well, and the burden for the unpaid care goes on these hospitals. I mean, that's what people don't understand and they don't connect, which is why
Mhm.
I'm sure it's a really important conversation at your critical access hospital conference, because the hospitals still have to treat the laws for them requiring treatment, which is called EMTALA for people that are emergency, like on their
Mhm.
property that come and needed help. It's required that they pay and get those kinds of things done. So it's got to be a big issue for them when they can't pay. It's going to be 100% on the hospitals
Yeah,
and or, you know, special dollars, special funds, and that's crazy.
yeah, it's going to increase bad debt. And we've been through the list of the struggles that we're going to see coming out of this. And so, it's a great time that in all of our states, we need to be engaging leadership and really looking at how are these rural transition funds, how are those plans going to be developed? What areas are they going to target? And what's in place to ensure, because it's not just about Medicaid, right? This
No.
affects everyone because Medicaid is just a payer for some folks, but the infrastructure serves everyone. And so when we start losing payers, then we lose the infrastructure that serves everyone. I don't think
That's
one
true.
always understands that, Renee. Yeah.
No, I don't think they do either. And I mean, I'm not the mathematician either, but a trade for $5 billion for 39 billion seems like I lost a lot of money. So call me crazy, but that doesn't seem like a good trade. So Jason, as we just finished up talking about data, you are having quite the experience in Texas. And so there's lots of just cultural events and things to be had. So you're in Austin and you were telling
Yes.
me about some kind of bridge. What are we talking about? Tell me about this bridge and why is it
Well,
important?
well, and I've heard of it before. There's a famous bridge, because when we go to conferences, Renee, it's always not all work. Like we like to
Oh,
explore a little bit of the world around us. And so we are next to the bridge, the famous Bat Bridge, that there's thousands of these bats that come out of this bridge. So if you stand on the bridge at 7:30 at night at sunset, the bats all leave at the same time. And so this is a tourist attraction. People go out on the river, there's boat trips to see all of the bats leave at the same time. You don't want to stand under the bats, though. You want to be above the bats. And if you're in a boat, you don't want to be too far underneath the bridge when the bats go, because for obvious reasons, you follow me.
who? No, I'm not doing that. This tourist is not doing bats, but I've had histoplasmosis. I'm not getting it again. Thank you.
Well,
There is no way that that's the most fun thing to do in Austin.
we
Nope.
walked under the bridge. You could smell the
No,
bats
no.
walking under the bridge, but we missed it because we were somewhere else last night,
Oh, darn
Renee.
it.
We
Yes, I
had
know
to
you
be
were
on an
somewhere else.
activity. We had to be on an
So,
activity for the
right.
conference.
The conference activity was what? Please tell us, because this is hilarious. Please tell
one
us.
of one of the original honky tonk, I don't even know what to call it, places. Like
Exactly. Place,
it was Roadhouse. Like
location.
if you can picture
Roadhouse.
Roadhouse,
Oh, good.
like if
Circle
you could
back to
just
Roadhouse. All roads lead to
the
Roadhouse.
like
Yes.
it was an old wooden structure, like
Love
tons
it.
of pictures of Willie Nelson
Love
when he
it.
was younger.
Oh,
And it was honky tonk. It was the most honky tonk bar I have ever been in my entire, it was like a movie set. Like this place is frozen in 1977.
That's amazing. My husband texted and said, "This is pretty cool." And I'm thinking, I think he's lost it because that's not normally a
Yeah.
Brent thing to do or say. But if he enjoyed it because it was
There
that
was
weird, then there
there
you
was
are.
barbecue. They were serving up barbecue, and it was packed, and it was really, I you can't describe it and
I bet,
really get the
I bet not.
feel.
I
Like,
bet not. Well, when you travel with Brent, he normally tells me that he could eat barbecue at every meal and be happy. Are
yes.
you barbecued out at this point, or you got more barbecue ahead? Because you got another
Well,
day and a half of this, so you're only kind of halfway. So where are we on the
well,
barbecue plan here?
he has a list of 10 places,
Oh
and
gosh.
I tried to interject. I did find a Texas chili place that I would like to try as well. So
Oh
we're
no.
going to see what tonight brings out of all of that. But
Yeah.
tonight we have a different fare.
Oh,
Here in another 15 minutes, I have to be downstairs for its donuts and beer run
oh,
coming
oh.
up. So you have
What
to.
is that? What is the donuts and beer
I'm
run? So we've
I'm
talked
not.
about this previous conference where you drank at night and then they let you run like a 5K in the morning and gave you a medal. But this sounds like
Yes,
it's a different combination because they're putting beer and donuts combined into this
together.
run. So what's a
Yes.
donut and beer run? And how far are you
I'm
going? Like,
0.5 miles. It's not actually very far. Um, I don't know, but it's in the official conference app. So it means it must be a real legitimate thing and activity. So because I'm here networking, I feel like I need to go to all of the
I can't
activities
wait.
for
If
the
you get another
conference and be
medal,
supportive.
if you get another medal, we're going to have to
I
show at a future date what the
Yes,
medal for the donut run could be
yes, it's a
because
good idea.
the
Yeah.
medal itself could be amazing if they actually use the donut and beer
So
combo. It could be
I
cool.
I forgot to tell you. So there was actually a honky tonk band at the
Oh,
honky tonk we were at.
of
And
course.
then we left there to go to another underground secret music hall that had full brass tubas, trombones, trumpets. It was fantastic.
You guys are having way too much fun. So the last thing I want to ask about, because when you told everybody on the podcast a while back that when we went to Austin, you were going to try the driverless Uber because that's one of the only places that exists. So far in this trip, has
No,
that happened
it
or we're
was
not there quite yet?
no, there's Waymos. This is the only place with the Tesla robo taxis.
Oh, even
And
better.
so
Pardon me.
no, it's so we have to Uber. So we're Ubering everywhere here. Brent doesn't have the button for the Waymo, and I think I do on my Uber app. So we're gonna figure that out. That was I was supposed to research that today, but we were too busy working today. So
Mm,
I've got to
sounds
find some
like it. The
time to
audience will
do.
definitely think you were working
There,
way too
there was
hard.
actually a lot of. There was actually I presented today. It was really a great, engaging day. But yes, we are going to have to
Still
at
time for
least
this
the
Waymo.
driverless Waymos are everywhere here. Like there's probably more driverless Waymos than other stuff, especially in this neighborhood where we find ourselves here in Austin. So it's just a lot of future, right? We got to think about this is how it's going to be. So make
Yeah.
the
That's what George Stetson said way back when, and here we are.
well. Here we
So
are.
we're finally here. So the recovery politician self-care policy of the week, you're gonna like it. It's called ROMO, relief of missing out. It's actually a term, people. I'm so excited I'm not in Texas. I can barely stand it. And part of that is because I had other things I had to do. And
Yeah.
I'm not sure, but if you just heard the itinerary, and I can only do so much barbecue before I'm done, and I really am real light on the honky tonk. And so for
Yeah.
me, it's cool that I get to be not doing that. Not that I don't, this was one that I'm like,
Mhm.
maybe I should have gone, but maybe
Yeah.
there's next year and we can try it out then. But
Yeah.
Romo now is now the new term. So if you're out there like me, maybe you're introverted, maybe you don't have all the energy at night. It's okay sometimes. And sometimes I get so excited when somebody cancels whatever I had on the calendar
Mhm.
and then I have an open hour. Like today I had a class that was going to 5. We got done at 3:30. I cannot tell you how excited I am. I got an hour and a half back of my day. And so that's Romo, people. You just relief of missing out. All right. Well, today we touched base with Jason. He's in between a lot of things, heading off to a new reception, meeting new people, doing all the networking he has to do at Torch. He's at the Texas Rural Health and Critical Access Hospital Conference and able to chat with all the people down there, bringing back good ideas that maybe we can use here in Iowa. And so we'll see you next time. You guys have a great day.